oftentimes we think about questioning orthodoxy. We couch it in those terms, right? But I think it goes down to thinking about what do we take for granted as normal methods. What are the normal methods of research? What are the normal methods of data collection in public health, say? And questioning those methods.
Hello and welcome to Idioms of Normality on Future Framed TV, the collective podcast series of Traces&Dreams. I'm joined today with Dr Diego Silva from the University of Sydney. Welcome, Diego.
Thanks for having me. Pleasure to be here.
Thanks so much for being part of the series. And before we get started, I'd like to ask people what perspectives and experiences bring you, or what perspectives and experiences do you bring to the question, what is normal?
Yeah, so my background is in philosophy and public health. So even though I guess the idea of what is normal isn't front and center in my research, it's actually kind of foundational and is always there, at least implicitly. So I think the first time I started thinking about what is normal was reading Norm Daniels' book, Norm Daniels' work on just healthcare allocation. And one of the questions that he's trying to answer in his work is you want to give resources, a disproportionate amount of resources to individuals who lack normal species functioning, or your sort of aim is towards normal species functioning. This idea that what healthcare is about and what trying to attain good health is about is to try to get at what a normal member of a species could expect in terms of health. And I always kind of thought that was problematic, even when I was kind of reading this. And that's not a dig at Norm Daniels, who's done amazing work, great philosopher and bioethicist, but it's problematic. He notes it's problematic. So I guess that's the first time I was conscious of it. But I guess the other thing I would say is that as I've gotten older within the academy and within thinking about philosophy and thinking about ethics and thinking about public health, the more time you realize that you're constantly bumping up against what people's perceptions of normal is. What's the normal thing to do during an emergency like COVID? And people have very different notions of what normal or the default is. So that's one example. What constitutes normal methods to do the kind of research that I do, or do the kinds of research that me and my colleagues do? So I think that it's always there looking in the background, which, makes sense. It's a big question. So I think it's always there. And I kind of like these opportunities that you've given me to sort of reflect on it. So glad to be here.
Oh, it's a pleasure to be here. And I love that his name is Norm Daniels as well.
I never actually, that's hilarious. I never actually put two and two together. There you go. Yeah.
But let me prompt you to reflect on the question now. Let's jump in with the basic but also incredibly complex question. What is normal?
Yeah, so look, I've been thinking about this question since you signed me up to be a guest here. So I think at first pass, there's sort of two ways that we use normal, at least two ways that we use normal. And then I'm sure there's countless other ways that we use the term. But the two that jump out at me is one, and this I guess is the public health training, is we think about normal in sense of statistics. So a normal distribution. And there what you're referring to is where do most people bunch up vis-a-vis X, whatever X that you're measuring is. And if things go according to plan, you have a nice normal distribution. And so we can think of normality as sort of statistical concentration of X. I think the second one, which I think fewer people probably think about, but is sort of front and center in my mind, given the work that I do, is around the idea of a norm. So what are the rules, whether social, moral, what are the rules for living? How ought we to live? And we can think about that in terms of things that are particularly hard to do, but we still ought to do them. You know, we should always be generous and kind. We often fail in doing so. But we can also think in terms of what are the rules by which society functions, by which a group functions. And it was really interesting because we had this discussion about me coming on before Christmas, and then Christmas break happened, and I read a couple of books. And it's you're primed to see things that you wouldn't otherwise see, but sort of discussion of normality in these novels that I was reading. One had to do with beauty, and the author stating that it's normal to be ugly, and hence you need to cover yourself. So that was one book. And then this other book talking about it was a book of short stories. It'll sound more gruesome than it was, but it's about cannibalism and the normality of not eating versus eating one's own species after normal death, after natural death. Again, I'm not proponent of cannibalism. I'm just saying that this was, but again, it was sort of playing with this idea of what is normal, what is a norm within a group. So yeah, I guess that's my first sort of kick at the can, I'd say.
Interesting. The two strands are very interesting, and I've never pressed an interviewee on the question of what is precisely the difference between normal, the word, and a norm in the sense of a social norm.
Yeah, I don't know the answer to that. So, I mean, yeah, I'm trying to play, armchair etymology on the fly.
Sorry,
No. Yeah, I mean, it's an interesting question. I mean, I would say that a norm is a rule, whereas something being normal is a rule that's been adopted. I don't know. That's a really good question. I need to look that up. What are your thoughts?
When you were talking about norms, it's sort of, and you used the word ought, things that we ought to do. And I was wondering whether it was prescriptive or idealistic or ideological, and what is the norm? Is a norm a barometer for how we judge other people's actions? Is it a barometer for how we judge our own actions? Or is it an ideal that we strive for and sometimes run awry? Or is it what we expect people to do? And so if they're outside of the norm, it's not necessarily good or bad. It's just outside our expectations.
So I think it depends on the field of study that you're in. So within ethics, when we're talking about norms, we're talking about rules of what ought to be the case. And generally speaking, and we can get into this if you're interested in it, but is the idea of norms being universal in some capacity. That is, that they apply to all people. So there's that sort of, that's where you get sort of the ought. I think in other fields, in the social sciences, and I'm sure it breaks down differently if you're in sociology versus anthropology versus psychology, but my apologies to those working in those fields. I'll sort of, what you have is a more descriptive sense of a norm, right? You're describing what a rule is for a particular group of individuals. And so I guess in a sense, you pretend to be detached and say, okay, well, this is the rule that governs a particular sorts of actions, X, Y, follow it, ABC don't sort of thing. In terms of ideal versus non-ideal, I think that's a really interesting question that is sort of always paramount, especially to applied ethics, which is sort of the stuff that I do. So the reason I raise that is because I was saying, norms and ethics, you're sort of setting up what an ought to be sort of thing. And it's this question about how ideal versus non-ideal are you going to be? Are you making prescriptions about what's the best thing if everybody was an angel, as it were? Or are you sort of taking people at a starting point of being human and being subject to, and again, I guess this goes back to the kind of the statistical, the descriptive sense of norm, taking people where they are at a given moment in time and then sort of prescribing norms that are sort of within reach to try to improve behavior or sort of, kind of improve thinking that way. So I think it's a live question how ideal or non-ideal we want our norms to be in ethics. And certainly it's the case in applied ethics.
It's quite funny, the idea from the book that you were reading, the idea that the normal is that everyone is ugly, and yet we have to hide that in order to present a social norm, which
Correct.
is beauty or not ugly.
Yeah, it's and the passage, I wish I had the book with me. The passage is exactly that.
Oh, really?
It's actually exactly that. It's it blends the statistical with the normative in exactly the way that you were saying it. Statistically, everyone's ugly, so there's this rule that we need to cover ourselves.
One thing I'm learning from these interviews is how valuable it is to actually disentangle, if that's a word, to tease apart the statistical use of the word normal and the more prescriptive use of the word normal, because people often blend them together. It's when you blend them together there's a lot of confusion, and also I think maybe trauma is going a bit too far, but a lot of social anxiety is created.
But I think you're absolutely right. Sorry, I think I interrupted you. I apologize.
Right.
But we're seeing this in the pandemic. So I guess to go back to, so my area of research is pandemics and infectious disease ethics, particularly around TB and pandemic preparedness of other diseases. So I did stuff on COVID, and it was always fascinating to me people availing themselves of the idea of evidence-based decision-making or evidence-based policy and being sort of diametrically opposed with the use of the exact same study. So a study would come out and people would go, look, this says long COVID is a problem. And then somebody else would say, look, this study isn't powered properly or isn't, and then vice versa. And there, I think what's interesting is that you have scientific values and scientific norms that are often not addressed by scientists and are sort of taken for granted. So the classic example being a randomized controlled trial being sort of the gold standard of evidence. Okay, fine. Are there instances when we can't randomize? Are there instances when we don't want to for other reasons? So I think that even the idea of evidence is imbued with value, but also imbued with what is normal and what we ought to accept as standards of evidence because of what is normal, what ought to be the case, right? P-value being 0.05. I think we were having this discussion previously, right?
Yeah.
That's a norm, right? It is normal that statistical significance is set at 0.05. How come? I guess my point that I'm trying to make is we often hide norms or the normative prescriptive under the guise of norm as statistical or
Absolutely.
Norm as objective.
I would 100% agree. And in the context of, say, diagnostics and treatment for infectious diseases like tuberculosis or COVID or other diseases that you look at, I imagine that norms of medical practice would change in relation to the technology available and the diagnostics available and the treatments available. And so even using that as an example is a way of demonstrating that normal has a history. That the p-value discussion that we've had offline about why 0.05 is used as the p-value. And I did look it up, and actually you're correct, but in terms of where it came from, it was first used in agriculture, but the very origins were of Blaise Pascal and another mathematician. They were they were working alongside each other to come up with this method, and then it got adopted and became the p-value.
There you go. Okay.
I forgot to send that to you. Very bad person. It's only geeks like me would get so obsessed about like something as obscure as a p-value. What's the history of the p-value? Where did this come from? But
I'm with you.
the reason I'm talking about things that listeners will have no idea what I'm waffling on about is because any norm of practice has a history to it. Why do we administer a certain amount of Panadol in each pill? Why do we administer a certain amount of paracetamol in each pill? Why do we go for the chest X-ray? Or why do we go for the smear test? Why do we go for why do these become norms of practice? Well, there's a history to it, and also there's a history in each particular location. The technology there might be better technology available, but the skills set of the people working in that area might be better equipped for other tools. And so you use the skill set in relation to the tools available, and that becomes the norm. But if you don't question where the history of the norms, then people can get set in their ways, fixed, and stagnate, I think sometimes too, causes problem.
Yeah, 100%. And a few years ago, I was doing a project looking at whole genome sequencing for tuberculosis, and in part sort of, designing sort of very sophisticated epidemiological, transmission chains using whole genome sequencing. And one of the things that came up was the younger lab folks knew how to do this and knew how to interpret it, according to their norms and according to their rules. But the physicians that they were speaking with couldn't follow the science along, or like they could follow it obviously quite a bit. But when it came to the nitty gritty, there was a leap of faith and a trust that the physician needed, that the doctor needed, that the healthcare team needed with the lab folks who were telling them, look, this is what's going on. The reason I kind of raise that is again, the sort of pushing through barriers of new ways of doing things and asking where do norms of practice come from. And then there's also sort of the norms of practice that you can't bridge, or that, you can bridge, but with a lot of retraining, say. It's the silo problem, I guess, through the lens of normalcy, or, what's normal practice. Yeah.
The silo problem, unpack that for a second. Unpack that. So the silo problem would be.
So yeah, this is I apologize for listeners. So the silo problem is this idea that as we become more and more knowledgeable about a particular topic, the deeper we go, the harder it is to explain all the variables and the parameters of the variables of a problem to those outside your field, or even sometimes those outside the handful of individuals who are dealing with the exact same topic that you're dealing with within a field. So that's the silo problem. It multiplies itself multifold across the academy, across the university, across knowledge disciplines. So I guess the reason I was bringing that up is because you had mentioned, and I think rightfully so, this idea of where do norms of practice occur, the sort of lack of asking about the history of these norms of practice. And then there's the splintering of these norms of practices, sort of only can be understood through a very small group of individuals, and can only be questioned by those very small group of individuals. So it's actually then easy to dismiss somebody's criticism because they're not an expert in that field. That is, they don't have the norms of practice that you do.
They're not critiquing me from the inside, and therefore their critique is null and void because they don't know the technicality.
Correct. Yeah, that's exactly it. Yeah.
Yeah, right. When we're talking about, I'm jumping around a bit, but when we're talking about what is normal for a human being, or what is normal for a tuberculosis patient, or what is normal for another animal, and we bring in the idea that any norm has a history to it, and exists in a particular moment, does that rub up against notions of change and transformation? Because I think when we go back to Norm Daniels's work, and if he's saying that medicine is about getting an individual back to a normal state of being for that person, then one of the pitfalls is applying the word normal in that context, and maybe we should be taking it out and putting something else in, so to allow for a bit more change, mutability, transformation.
Yeah, I think where we see this sort of line of argumentation in bioethics is a lot through people who are looking at the question of enhancements. So whether it be neurological enhancements or physical enhancements. So there, the idea is exactly that. You know, do we want to use fancy gizmo X that, you know, to get a person up to normal functioning? Or do we actually want to enhance humans to go beyond that? So I watch too much sports, but the classic example is steroids, or performance enhancing drugs more broadly as a category, right? So there's issues around harm to health, but there's a lot of newer performance enhancing drugs that aren't as harmful, or perhaps we don't know their long-term effects, but aren't sort of the anabolic steroid sort of thing that we sort of grew up with, those of us who grew up in the Olympics of the 80s and 90s and aughts. There, the question is, what's the purity? You know, we're wanting to maintain the purity of the Olympian, say, or the purity of the athlete, which has underneath it, I would say, norms.
Normality and purity are very conflated concepts, and again, also leading to problems. Yeah,
wholeheartedly. But you get into this discussion of you want your athletes clean, right? It's a norm. We want our athletes clean. So we don't want them doping because it's abnormal. But you know, don't we want? I mean, our athletes are superhuman in the first place. Like, I'll never be able to like dunk a basketball like LeBron James, like ever. So like, you know, we admire these individuals.
Come on, you're better than that. Come on.
If I just tried the new latest shoes, but so it's this weird thing where exactly if I understood, or maybe I'm kind of reinterpreting it a different way than you wanted to go, but this idea of enhancement becomes sort of morally problematic in a way that is sort of unclear to some, I'd say.
And it's funny because once enhancement becomes the norm, it sets moral imperatives on the people who have chosen not to go with the enhancement.
And it gets into questions of equity, right? So this is the big problem with genetic enhancement, say, is that we know that new technologies aren't equitably distributed. So it will always be richer individuals, people with access to these technologies, which tend to be rich, historically tend to be white, who will have access to the enhancement technologies. So then you get into social justice issues around things that try to break free of what is normal. And the fear is that by enhancing or by providing these enhancement mechanisms, you're further perpetuating what the state of normal, which is injustice. So you have it's this weird dialectic, right? It's this weird back and forth between what is normal, what isn't normal, and between what ought to be normal and what ought not to be normal. And it's this sort of dance. I don't know how, it's a complex little problem that you're tackling.
And it seems like that normal constantly wins because the social inequity is perpetuated, and normality is forever out of your grasp. It's like it's forever just outside of your grasp, because even if there's a new normal that's set, there's a new normal on the horizon.
That's right. I think that's right.
An even better new normal.
An even better new normal. Yeah, that's right.
The new normal is a phrase that we've been seeing a lot over the last couple of years, and I think you might have some really interesting perspectives on it. And I can also almost hear some of my viewers saying, "Hey, did he mention COVID? Ask him about the last couple of years and what's been happening with the old normal, the new normal." And
yeah, look, you know, I think it's fascinating. I've used this language myself. You know, it's impossible not to, right? It's not like I walk around being self-reflexive the entire. Most of the time, I'm just a blind idiot walking around. So like I don't, you know,
I think the rest of us are too. We just don't admit it. We kind of, we're like the emperor wearing his new clothes. We pretend like it.
It's a miracle I don't run into walls more often. But I think, yeah, look, I think the idea of normality around pre-COVID, post-COVID is fascinating. Oh, I don't even know where to begin with that. So
Can I go for a
yeah,
prompt? And because this is bad interviewer here because I have some ideas and I'm throwing them up against the wall and seeing if they stick
please
or
do.
if they're not. But I sort of feel like the old normal got us into the trap because, like we were shunning food of people who weren't white, European. What was European food was good and healthy and that wasn't part of illegal wildlife trade. But then, these foods that were considered, fringe by European standards became much more common on black markets. And because they were sort of on the black market, like, if it's true that COVID came from a pangolin originally or into bats or whichever way it came, either way, it was in a very poorly managed trade of wildlife. And I feel that ostracizing that trade meant that it didn't have the ability to find regulations like norms of practice that maintained the health of those organisms so that they wouldn't incubate disease and spread it to other organisms. And I kind of feel like that old normal got us into this trap.
Yeah, I hadn't thought about it that way. I think you're right. I think that's a really useful way of thinking about it. As I was listening to what you were saying, again, this duality or this sort of dance of normal, abnormal, and description and prescription. Like one thing that people are saying that, who study the actual like nitty-gritty science of this is that the new normal is that we're going to have a few more, sorry, listener, but we're going to have a few more pandemics before, if you're in your, your 30s or 40s, you're going to have a few more pandemics before, you probably expire. And part of it is because of climate change, right? And this is right up your alley, obviously, more than mine. But this idea of we've always coexisted with animals. There's no human outside of an environment or the environment. But the stuff that we're doing to the environment is unprecedented. It is abnormal in the history of humanity, in the history of the earth. I don't know if that's
absolutely. And the environment's like, whoa, you're throwing at me all these chemicals and I don't know what to do with them. And I haven't developed bacteria to digest that yet.
Exactly.
Yeah.
And so what I think is really interesting about what you were proposing about these sort of something being ostracized because it's not, of the dominant class, right? Eating particular animals because it's not of white European heritage. So it gets ostracized, so it becomes part of the black market. And so we need norms around safe consumption. The question is, what is safe consumption? And I don't mean safe consumption of pangolins, by the way. I mean, how do we think about safety and consumption in 2023? And I mean, another conversation we're having offline was about the fact that the Earth is now at 8 billion people.
Yeah.
We're past it, right?
Yeah.
People are estimating. What does safe consumption look like as consumers, as humans who consume, right? What's a normal amount of consumption?
And consumption is an important factor into thinking about over 8 billion people on the planet because, only maybe a third of those people are below the poverty line and not consuming as much as the top 5 or 10% who are consuming well over their share. So it comes back to that inequity question again. Comes back to, multi-billionaires trying to shoot themselves off onto Mars, and which consumes an incredible amount of resources, and employs people in jobs that they could be employed doing something else. Maybe something a bit more involved in equitable distribution of resources. But I think, if you just think about the 8 billion figure, and you think about norms for the 8 billion, you don't realize that there are norms for the 5 or 10% that are completely different to norms for the lowest 1/3. And so consumption is end of that waffle is that consumption is such an important concept to bring into any discussion of that population figure. And you're talking about safety and consumption. What are the limits? What is safe consumption? Because if we were to divide the discussion of normality into description and prescription, well, the description is we're over consuming basically, and then the prescription is consume less, right? So the norms should be that we consume less, but when we look around at everyone else, well, we're just consuming as much as the next person. You know, I'm driving my car just as much as the next person. I'm using electricity just as much as the next person. So we can sometimes make ourselves feel better by looking around and going, oh, well, you know, I'm not doing any worse than anyone else. And you know, I think, look, jump in at any time because I'm throwing ideas out there.
No, yeah, but
there's something I think we need to take from people who not necessarily denying climate change messaging, but are wary of it. Because the imperatives that are being pushed on people is you should be consuming less. You should drive your car less, use your bicycle more, use less water, use less plastic products. So people are pushed, this messaging is pushed upon them. But when they look around them, what is normal is to consume. What is normal is to buy the product that's wrapped in plastic. What is normal is to drive your car to the shopping center rather than... So what is normal in terms of daily practice and what is normal in terms of the imperatives of this green messaging being pushed on people, put people in conflict with themselves because they buy that plastic and they see the plastic and they're like, oh, I shouldn't be buying this plastic, but I need to buy what's inside this plastic because that's what's readily available for me to purchase right now to feed my family or to get through this day. And it sometimes I feel like the messaging around the prescriptive norms that are being pushed on people through the vehicle of green messaging or conservation messaging is a bit unfair because it doesn't change the structures within which those people are operating. And it offloads responsibility from the big companies who are packaging everything in plastic or, you know, pushing petrol cars onto you or, you know, whatever. They're not changing the structures that we're working within, and putting that anxiety onto the individual just keeps consumers at conflict with themselves, as opposed to expressing that conflict as a sort of a politicized citizenry demanding change.
So it's easier to try to change individual behavior than it is to try to change systems. And so we're guilty, those of us working in public health, we're guilty of perpetuating individual level behavior change, which is exactly what you're describing instead of, and part of it is, look, it makes some marginal difference. Is it enough to save the earth? Or not save the earth, but save us from extension from the earth. I think that you're right. I think that it gets back to issues of justice and equity that you were alluding to, which is a very small portion of humans consume a disproportionate amount of resources, and this is a problem. The opposite would be, or kind of the counter would be, do these individual level messaging, does it raise enough awareness such that it then gets people to sort of vote towards certain parties and away from other parties? Because they'd say, well, yeah, I should actually be using less plastic packaging, so I'm going to vote for the party that says, you know, we're going to institute ways of reducing plastic packaging. That's a really roundabout way, and there's probably more direct ways to try to affect systems change. So but I think you're right. I think that what we have, I think in general, are simple individual level solutions to problems that are complex and dynamic and wicked and, you know, that are multi-scalar, like that exist. I don't know if that's a word, but they exist on multiple scales. And we tend to focus on individuals less so, or, you know, probably disproportionately relative than going to sort of trying to affect manufacturing and so on and so forth.
I think turning the individual into a unit of analysis is very much the project of normality as a concept. You know, if normality has agency, let's entertain that for a moment. I feel that part of that project, part of normality's project, is to make sure that we think of ourselves as individuals, that we individualize our decision making, that we don't collectivize. I'm not sure that, you know, when and again, this is where public health in particular is competing against a very strong narrative history of individualization. Because public health is about, well, you know, wear that mask, look after the next person, get yourself vaccinated, look after the next person. And it's about herd immunity. It's about, I mean, maybe I'm paraphrasing it poorly, but isn't it about collectivizing a little bit?
Yeah, I think so. I think what's interesting is to go back to something that you said earlier, which is the unexamined norms. So I think public health has a much more collectivist approach. It's in the word public. There's an inference that can be drawn by the very use of the word public that leads to collectivist notions. So again, people are having discussions about what is exactly the relationship between the idea of a public versus a collective and stuff. So whatever, we can kind of set that aside. But what I think is really interesting is this public health as a field. This is a paper that a couple of colleagues and I wrote several years ago now, over probably like a decade ago now, which is scary. But the paper was called Disadvantaging the Disadvantaged. And the argument that we make in the paper is that public health inadvertently disadvantages people who are already in a position of disadvantage. So think about the snap lockdown. So again, this is an international audience, but think about the lockdowns that occurred around COVID. And they're often snap lockdowns of particular regions, particular areas. Historically, we know that people who are going to be subject to lockdowns in a very unstructured, ad hoc, again, you know, one moment you're free to go about moving where you'd like to, and then the next you don't. We know that this is disproportionately people who are of lower socioeconomic status. In countries like Australia and Canada, US, UK, they tend to be non-white populations. So that the brunt of these public health measures, for whatever reasons, and they're multifaceted, tend to be felt by disproportionately people who are already marginalized. And the justification always is, but we're protecting the public, but we're trying to protect the community. And that's all fine and good, but if it's if you don't reflect upon the values and the way that you articulate those values, the ways you're trying to express those values, you can run roughshod. And it makes sense, right? Because people working in public health, say in Australia where we're at, tend to be white, well-educated, upper middle class. Our experience of normal is going to be a particularly different type than somebody who's working a contract job delivering food, right? So I think that our experiences of what is normal in public health shape our understanding of what exactly is collectivist in public health, which then runs against what I think you're right is sort of, at least in a place like Australia and other sort of liberal democracies, tend to be sort of individualist sort of ethos.
I love the title of that paper, Disadvantaging. I love the title of the paper, Disadvantaging the Disadvantaged.
Yeah, thanks. So anyways, this is a really long way. Now I'm just kind of going off, but I think there's really interesting questions about what are the collectivist values, how are they expressed, and on the basis of whose notion of what is normal, whose notion of what is normal descriptively and prescriptively.
Including as many different diverse voices as you can in the discussion of what is normal. Does that help to
Yeah, so I think the big push, and I think where the thinking has been over the last 10 to 15 years is a big push towards community engagement. This idea of engaging individuals of lower socioeconomic status or going into the communities and so on and so forth. I think it helps. I think it has helped. But we do it in a piecemeal fashion. We tend to forget about, so in the case of COVID, we tend to forget about doing this legwork that you're describing, this sort of engaging with people of diverse backgrounds. That's something that you do during non-pandemic moments. It's not, you don't do it, well, I mean, you do it during a pandemic, but you do a lot of the legwork in between, so that when you have to have a snap lockdown, you have translators in those communities. You have materials ready to go in the local languages of those communities. And I'm talking about like Melbourne, Sydney, Brisbane, Toronto. Like I'm talking about like multiculturals. Like that's the kind of legwork that needs to be done in order to equitably be able to then say, well, on a precautionary basis, we're going to lock down a particular, so I think there's a lot of work that needs to happen during peacetime, as it were, to kind of adopt that language that we fail to do because we get distracted by something else that's shiny and brings in a lot of money.
Yeah.
Myself included, by the way.
Yeah,
right.
Yeah.
So like I'm certainly not part of it.
So do you feel that the lack of this kind of community engagement led to some communities feeling disenfranchised by the way in which snap lockdowns took place?
Yeah, so I guess the big example I have, there are many examples in many different places. The one that sort of has left the most sour taste in my mind, I guess, was in July 2021. There was a snap lockdown of 9 public housing towers in Melbourne.
Yeah.
And the chief medical officer in the state of Victoria argued that it was done on the basis of the precautionary principle. So actually cited the precautionary principle. So what they did was, without any warning, they were afraid of transmission amongst these towers, these public housing towers, and it then further seeding an outbreak. And so they descended on these 9 public housing towers with police. So it wasn't that it was, led by public health, that it was working with community organizations. It was just police literally setting up a cordon sanitaire, literally setting up perimeter. And there was a big Muslim population, didn't have halal food. They didn't account for how people were going to take garbage out of their apartments.
Yeah.
So the Guardian newspaper has a really long sort of after the fact description, firsthand account of what this was like. I mean, many people do. So again, there was a lack of, and this was done on the basis of public health. So this goes back to, what are the norms of public health? What is the normal course of action in public health? Stop transmission chains, right? It all goes back to what is normal. What's normal is to stop transmission chains. That's what the normal thing you want to do during an outbreak. Right?
Sounds like very mechanical. Yeah.
Exactly. It's exactly. I mean, it goes back to, I think, this point that you made that I keep coming back to, which is not acknowledging where these norms come from, and the history of these norms and how they're used.
This leads beautifully to the next question, which is, so what questions do you think we should ask about normality?
I think the most obvious one to me is probably still the best one to start with, which is what is normal, and why do we think what is normal is normal? And this is what I hope we're doing in like the Masters of Public Health here at the University of Sydney, and we're trying to do with the bioethics. Like, to me, when I teach non-ethics people about ethics, it's just to get them to see that there's values underneath policy and practice that they thought was value free. And then the second is to question it. And so I think that oftentimes we think about questioning orthodoxy. We couch it in those terms, right? But I think it goes down to thinking about what do we take for granted as normal methods? What are the normal methods of research? What are the normal methods of data collection in public health, say, and questioning those methods? So I don't know if I don't know if I've answered your question, but I think it's coming back to this question of what is normal and why normal. And you can ask it in terms of description and historical question. How did we get to 0.05? But then also ask why normal, as in why keep it up?
Yeah.
And the answer might be because there's good reasons.
Why continue with normal? Yeah.
Why continue with normal? And there might be good reasons, right? A, B, C. But you better be able to articulate it.
Yeah.
You better be able to defend it. So I think that's where I would start, I guess. It's a big question and a good one. Yeah.
I like it. Why do we think what is normal is normal? It's a great question. Yeah. I mean, it's tricky. This is one of those times where I'm like, how would I write this down? Like, what's the grammar for that question? Why do I think what is normal is normal?
Yeah, exactly. Yeah.
It's a tricky one. I know exactly what you mean. It makes me want to study bioethics again. Diego Silva, thank you so much for your time today. It's been great chatting with you, and I realize that our time is almost up. And we've spoken about so many things. We've touched on COVID. We've touched on the history of statistics. We've looked at some of your areas of interest, in particular this paper that I'm now going to be Googling in 5 minutes after we get offline.
Happy to send it to you.
What's it called again? The
disadvantaging the disadvantage.
Disadvantaging the disadvantage. I love it. Well, thanks again for your time, and thanks for
Thank you
joining
so
us on
Yeah,
Idioms
pleasure.
of Normality.
Thank you.